Hi, my name's Charles, and this is my clinical exercise intervention. My client information is a type 2 diabetic, which was unfortunately diagnosed through a fasted plasma glucose test, showing 130 milligrams per deciliter, which is above normal range. Additionally, his fasted triglycerides shows 153 milligrams per deciliter, which again is above that abnormal range. Further down the line, he got tested for hypertension as he really was seeing effects from his exercise, and unfortunately, he got diagnosed but with 141/89 blood pressure, which is known as hypertensive. Now, from his description, he's a 36-year-old male, father of two, standing at 177.8 centimeters and 102 kg. So from this, we can calculate his BMI as 35, which we all know as obese. The medication he'll be taking is 500 milligrams of metformin and 5 milligrams of ACEIs. Now, these are very good medications because they do not have any issues, and also together with exercise, they have no issues there. They are very safe to be used while also being extremely effective in improving glucose sensitivity and reducing blood pressure. For his social and exercise history, he has a really high stressful job managing companies' finances at a high economic stressful time. So in his mind, he cannot think of exercise at the moment. It is not a priority for him as he feels very responsible for this company. He enjoys playing golf on Sundays with employees and friends, but other than that, has no real further physical activity in his life. He used to play soccer from 15 to 25. However, he stopped due to work, and he really felt there was a lack of passion for it. He tried getting back into exercise, but yet unfortunately he fell off the wheel again. He tried running and cycling, which were good because it got him a few gym sessions a week, which he enjoyed out of the house, and also he really enjoyed the social aspect. Barriers and goals, as I said before, work is a big barrier for him. His kids, he wants to be really present in his kids' life and puts that also in front of his physical activity as a priority. He really feels fatigued throughout the day, especially after work. Um, and he really feels illy educated, which is a big problem at the moment globally with people starting their physical activity journeys. They really feel ill educated and they can't seem to find out where to start. Now, his goals are to lose 10 to 15 kg by the end of the year. He wants to be able to keep up with his kids, wants to feel more energized throughout the day. So again, keeping up with his kids after work and, helping clean up around the house and just being more active with them. Improve his medical state, so all his symptoms that he's experiencing. And like I said, he wants to be more educated and he wants to sort of be a inspiration to people around him and tell more people about physical activity as he wants to be educated himself in this. Now, here's my exercise treatment benefits. So for type 2 diabetes, we have short-term and long-term benefits. We're going to see increased energy expenditure during and post exercise. So high intensity aerobic exercise boosts calorie burn for up to 14 hours post session, adding 40% more energy usage throughout the day. Additionally, resistance training extends its effect up to 22 hours, raising resting energy expenditure by up to 5%, 72 hours post exercise. Exercise also releases irisin, which is a muscle borrowing protein that enhances thermogenesis and fat metabolism. Glucose metabolism is another benefit. So we're going to see type 2 diabetics is a condition where it disrupts insulin-dependent glucose uptake via GLUT4. And when we have these muscle contractions during exercise, it's going to trigger GLUT4 to translocate, which means it allows glucose uptake without insulin. It's also going to increase blood flow during exercise, which enhances glucose delivery and uptake by muscle cells, so regardless of the insulin. We're also going to see insulin sensitivity improve. So exercise enhances insulin sensitivity for up to 72 hours after training. We're going to see greater muscle oxidative capacity and max. So those type 2 more oxidative fibers, which is going to have higher glucose absorption. And even 60 minutes of low intensity exercise can improve insulin sensitivity for up to 24 hours in obese adults. Next, we're going to see blood glucose control. So 12 weeks of aerobic resistance or combined training all significantly lower blood glucose. Combined training is obviously the most effective, and resistance training consistently reduces HbA1c levels across all studies. So these levels are going to be testing for those glucose and that sensitivity. For long term, we're going to see a benefit of body composition and adipose tissue. So Exercise reduces visceral fat. So that's that fat around the liver, which is a key driver for insulin resistance, driving you towards type 2 diabetes. There's also an inverse relationship between body fat percentage, BMI, and type 2 diabetes risk. Exercise increases serum 1 levels, which just improve insulin sensitivity. It's a sort of metabolic reaction that happens. Dyslipidemia is a condition where there's high fats in blood and it affects 30 to 60% of people with type 2 diabetes. Exercise is going to lower these fat in the blood, these triglycerides, these VLDLs, and the LDLs, while increasing the healthy cholesterol known as HDL. Lastly, we're going to see improve in nerve function. So something like Tai Chi can improve over 12 weeks, improves balance sensation and glucose control. Moderate treadmill exercise can even reverse neuropathy progression, excuse me. Aerobic and resistance training together improves nerve function, which is supported by 11 of 12 randomized controlled trials. So we can just really see that exercise alone, no matter the type, really, that's the main takeaway I feel, just improves type 2 diabetes across the board. Hypertension. So the main thing with hypertension is inflammation and adipokinesis, which these biomarkers are leptin resistant and IL-6. So 6 to 12 of moderate weeks of moderate exercise decreases these biomarkers, reducing inflammation and boosting metabolic rate. Hypertension and diabetes are closely linked with chronic inflammation and dysregulation, including leptin resistant and IL-6. So these hormones influence vascular tone, insulin sensitivity, and sympathetic nervous system activity, which all contribute to diastolic blood pressure. We're going to see leptin reducing by 15 to 30% across the board. We're going to see resistant, which is going to be reduced by 10 to 20%. Regular aerobic or combined aerobic resistance training can do this. IL-6 is going to act as a pro-inflammatory rather than anti-inflammatory when it's released by muscle proteins and muscle cells rather than the adipose cells. And all up, we're going to see diastolic blood pressure being reduced as regular exercise training reduces it by 4 to 6 millimeters of mercury in hypertensive adults. And this reduction is linked to a 20 to 25% lower risk of coronary heart disease. Now we're going to be looking at my exercise prescription. So just starting off on our exercise prescription, we're going to be starting with resistance training in a class setting. So the exercise selection I've chosen is going to be all machine-based. It's going to be a leg press followed by a chest press, a lat pull down, horizontal row, hamstring curl, dips, and bicep curl. 3 sets of 8 to 10 repetitions at a 75 to 85% maximum heart rate, 2 minutes rest. So as we've noted before, these implementations of resistance training is really going to help with that blood glucose. And these protocols that I'm going to implement to sort of make sure that everything is going to run smoothly and no complications during the exercise. We're going to have 5 to 10 minutes active cool down. So after and warm up. So before, we're going to be on the bike, making sure we're getting that blood pumping. And then after, same thing. We're going to be taking heart rate, blood pressure, and blood glucose before, during, and after exercise to make sure we're in the safety ranges, because we don't want any complications during exercise, as we're really trying to improve the condition here rather than reducing it. Now, as I mentioned before, the benefits we're going to see specifically from this regime is going to be a reduced plasma glucose and HbA1c, and significantly reduced systolic and diastolic blood pressure. Now, we're going to see as my next exercise intervention is aerobic training on Tuesdays, Fridays, and Saturdays. The exercise selection is going to be class swimming on Tuesdays and Saturday mornings. This is a low impact exercise, which is really going to help with less inflammation during exercise and training. And it's also just a great way to get into exercise. It can be seen as a fun sort of really working towards a goal sort of thing, rather than just like straight running and things like that. So 35-minute sessions of 4 laps of a 25-meter pull with a 5-minute rest in between. So this sort of interval training is really going to help with sort of, as you can see, HbA1c reduction, improved insulin sensitivity, and reducing adipose tissue. We're going to be working at a 70 to 80% of VO2 max. So these two sessions are going to be our vigorous sessions of the week. We're going to be following it up with a spin class, which is more of a 50 to 60% of VO2 max, which is our moderate session of the week. So as I've noticed through my research, duration and the guidelines have seemed to be 150 minutes per week of moderate to vigorous aerobic activity, or 75 minutes per week of vigorous activity. There has seemed to be no real implementation of specific exercises. So for this reason, it really doesn't matter what kind of exercise you're doing. It's more about the duration, and it's more about making sure you're actually being active, which is why I've chosen to mix it up with swimming and spin classes to sort of have that social factor there, which he really enjoys, and get him out the house and in a gym environment. Same protocols we've got going on here, as well as supervision, because you need a coach for the swimming and the spin classes as well. Now, Sunday and Wednesday is really going to be sort of still doing his daily routine. He's going to be spending a lot of his time with his kids and sort of have a recover and wellness check day, because when jumping into a plan like this, it can seem to be daunting and really heavy on someone who's new to this. So it's really good to be able to check up on oneself and recover. But however, every day I do want him to have 30 minutes of walking, 15 minutes in the morning, 15 minutes at night. As we can see through these studies, it improves glycemic control and insulin sensitivity. Effective, safe, and low cost. Anyone can go for a walk. It increases your BMR and decreases adipose tissue, helping him reach those goals, and significantly decreases both systolic and diastolic blood pressure. Now, for specific to my client, we're going to be looking at inflammation playing a huge role in the development of persistence of fatigue. So he mentions how fatigued he is throughout the day. So when we reduce these inflammation biomarkers, we can see that energy consistently going up. He's going to be getting a more aerobically fit and more social, which is something he really wanted to be able to do, to have fun with his kids. And he really enjoys the social aspect of physical activity. And we're going to be decreasing that adipose tissue, which was one of his goals heading into this towards the end of the year. Thank you.